Pain and knee pain. What is a person to do? Have you been living in pain because you're afraid the only option for relief is a hip or knee replacement? Well, there are more options you should know about. Dr. Barry Waldman, an orthopedic surgeon and hip and knee replacement specialist with OrthoMaryland, joins us this morning with more. Good morning.
Good morning.
All right, so it sounds bad enough if you have to have something replaced. Good to know there are other options. What are we talking about?
Yeah, so patients with severe arthritis have often had to turn to total joint replacement, which is a replacement of the entire joint. There's new technology available that allows us to replace just the parts of the joint that are worn out, and this is called joint resurfacing.
Well, that sounds like a much better option. How do you know if you're a candidate for that as opposed to the whole deal?
Generally, doctors will take x-rays, they'll examine the joint that's afflicted and look at how much deformity there is. And in patients that have just small parts of the joint worn out, we can often do this smaller procedure that allows them to go home sooner and recover faster.
Drawbacks to that? Because it sounds like, you know, if somebody's in pain, that would be the way they want to go, but are there any drawbacks to that?
Yes, there are some patients that have too much deformity, they have problems with the bones that are out of alignment and need total joint replacement. There's also the risk that later on other parts of the joint may wear out and they may require further surgery.
Is this something that most people don't know about? Is word just getting out about this, or is it fairly common?
It's fairly uncommon and most patients don't know about it. There are a few doctors that are trained to do this type of procedure, and luckily we've had a great deal of experience doing this at OrthoMaryland and have been able to help quite a few patients.
All right, give me just a side-by-side comparison. If you have to come in and get the whole replacement versus having the resurfacing in terms of how long it takes to recover, how long it takes to actually do this, I mean, walk me through that.
So for example, a patient with a total joint replacement might need to stay in the hospital for 3 days, often need a rehab stay in the hospital for as much as a week or two.
Okay.
A patient that has, for example, a knee or shoulder resurfacing can go home the same day, often can start physical therapy as an outpatient, and can recover in about half the amount of time.
Is it mostly for those patients? You mentioned arthritis. Is that typically what they come in for there, or are there a lot of other kinds of illnesses that prompt them to need this?
Yeah, the majority of patients are suffering from osteoarthritis, which is the typical wearing out of the joint. But we also have patients that have, for example, rheumatoid arthritis or have arthritis after an injury that are good candidates for this procedure.
And you've done a lot of these procedures?
We've done quite a few, unfortunately.
All right. Well, it sounds like a much better option if you have to do one or the other. Give me just a breakdown. If 10 people come in, is there a way to, you know, the majority of them would be candidates for this resurfacing?
There's a good chance that as many as 30 to 60% of them are good candidates.
All right. So people have been getting things they don't necessarily need for a while.
That's true.
All right. Well, thank you so much for joining us. I'm sure a lot of people want to hear that. They're going to be calling their doctors now about Plan B. Thank you.
Thank you.
Well, for more information, go to foxbaltimore.com and click on Your Health Matters. Coming up, ever feel like a broken record nagging your kids again and again?